Welcome to Lecture 2 of our First Trimester Ultrasound course. In this session, we will focus on first trimester anatomy with an emphasis on anatomical landmarks and their sonographic correlation. Mastering the visualization of these early structures is essential not just for confirming viability but also for setting the stage for early diagnosis of anomalies and guiding optimal prenatal care. Let's begin by exploring what we should expect to see and how to systematically interpret it. By the end of this lecture, you will be able to confidently recognize and understand the anatomy of key first trimester structures, including the gestational sac, yolk sac, embryonic pool, and the surrounding cavities. You'll also learn how to correlate these sonographic findings with the expected developmental milestones, allowing for accurate assessment of early pregnancy progress and identification of normal versus abnormal patterns. Let's dive into the anatomy step by step. Let's begin with the gestational sac, the first visible structure within the uterus in early pregnancy. A normal intrauterine implantation is typically located in the fundal or midcorporeal region of the endometrium, always away from the lower uterine segment or cervix. The sac should appear round or oval in shape, and by 4.5 weeks, 4 plus 4 or plus 3 days, it grows at a rate of approximately 1 millimeter per day. Look out for the classic double decidual sign, a reassuring marker of intrauterine implantation, and remember, the growth rate of the sac is not just for measurement, it's also a critical parameter for accurate dating and viability assessment. On transvaginal ultrasound, the gestational sac should be clearly visualized by 5 weeks of gestation. A well-defined decidual reaction surrounding the sac confirms early implantation within the endometrium and is a key reassuring sign of a developing pregnancy. However, be cautious. Features like an irregular sac shape, thin decidual lining, or the absence of a yolk sac when expected may indicate a non-viable or ectopic pregnancy and should prompt close follow-up or further evaluation. This 3D ultrasound image shows a beautifully defined 5 weeks gestational sac, highlighting high signs of healthy early pregnancy. Note the clear double decidual ring confirming intrauterine implantation. Its fundal location aligns with normal positioning, and we can also appreciate a well-formed yolk sac and even a visible embryonic pool. These features, when seen together, represent reassuring early markers of a viable